passcode or just capital C and then lowercase ALVARY. So we'll see what.
I'm not sure if it makes a difference, but Miss Kimberly, do you know?
Or just capital C and then lowercase ALVARY.
I believe that, yeah, you need to have the uppercase then lowercase, but don't hold me to it. I just did it like I saw it.
Or just capital C and then lowercase ALVARY.
I believe that, yeah, you need to have the uppercase then lowercase, but don't hold me to it. I just did it like I saw it.
Or just capital C and then lowercase ALVARY.
I believe that, yeah, you need to have the uppercase then lowercase, but don't hold me to it. I just did it like I saw it.
Or just capital C and then lowercase.
Do we need to mute someone?
Charlotte, go ahead and type in the login data. Actually, let me see. I'll move this out of the way. I could probably.
I did already.
You did? You typed it in?
Yeah.
Okay, so if it's in the chat, in case someone wants to.
It's there.
Is there?
Right there. Okay, perfect. Okay, we'll give people a few more seconds to come in. We know that they're coming in from different spots and spaces.
Sure, sounds good.
Right. We'll give them maybe a couple more minutes and then we will jump right in. All righty.
How you doing?
All right. How's everyone? Okay. So far we have 16 participants. We know that there are members coming in from 3 different churches that we are aware of that is on this immediate city block. We'll kind of present those pastors and churches momentarily, but in the meantime, we'll just give maybe another minute for people to come in. I'm getting texts. Let's see. Oh, there's not someone trying to find us, so that's good. Okay, we're going to go ahead and get started. And those that are not with us just yet, they will catch up. I am Dr. Virgil Jones, pastor of the Calvary Baptist Church of Los Angeles. We have 3 churches on this city block. The second church is St. James Apostolic Church. And I believe Dr. Mesrobian is here on the line. So we thank God for him. And then the third church on this corner is Knox Presbyterian. And I did get a call from Pastor Ragland, who shared with me that he had a family emergency come up, which will preclude him from being on the call, although he said there are persons from his parish that will be on the line with us. So we'd like to quickly hear from Dr. Mesrobian really quickly, and then if you're from Knox Presbyterian, we'll ask you to raise your hand. You can just hit the icon in the reactions, and then we will know who to call on. If you are, okay, I see Betty Moore, good. All right, Dr. Ms. Robian, would you like to say a word, greet us? Now you gotta unmute yourself, Doc. You gotta unmute yourself first, Doctor.
You hear me now?
There you go.
You hear
All
me?
right.
There you go, buddy. Dr. Jones, it's always a pleasure seeing you, my friend.
Yes, sir.
I really appreciate you putting this effort together because I think it's not only informative, it's absolutely essential for our community to be informed as to what's going on in the vaccine world.
Correct.
And we appreciate all those who are joining us today, especially the people from the Public Health Department of Los Angeles. And I'm looking forward to see what they have to offer because we do have quite a few concerns and questions that our congregation has been asking me to bring it to your attention, and hopefully they'll be answered today.
Great. All right, and well, I think it was Betty Moore from Knox Presbyterian. We'll give you a chance to speak on behalf of Pastor Ragland.
No, I believe that Tracy Lyons, he has designated Tracy Lyons to speak on behalf of him. I'm just a participant.
Okay, great. Okay, Tracy Lyons, would you please speak at this time?
Sure. Hi. Thank you for organizing this. We're just really pleased to be a part of it and help get the word out and learn a little bit and have information shared.
Perfect. Okay, so our panel discussion is going to feature Dr. Jerry Abraham. He is a Harvard Emory University of Texas USC trained family, community medicine physician. He's a global injury epidemiologist and a medical quality specialist caring for patients in South Los Angeles, specifically at Kedren Health, a historically Black institution. At Kedren, some of his responsibilities include acute psychiatric treatment with those that come in and out of the Kedren facility. It is a federally qualified health center. And the plan is to vaccinate as many people as possible. From the Biden-Harris campaign, they were looking to do 1 million people in 100 days. And so we know that there has been much interest in trying to get this done. And the challenge is, you know, when people don't know that much about the vaccine, they do know enough about the virus to know that if you don't wash your hands, if you get too close to people, if you get sick and you don't quarantine yourself, you can pass the disease to others and you can die from the coronavirus. Now, those are things we know clearly. And so we're going to give Dr. Abraham a chance to sort of introduce himself a little bit more specifically than I was able to do. And then we will field questions. I guess if you know you have a question, just use the reactions button on your phone, tablet, or computer, and you will see on your reactions where it says a raised hand. If you can, if you don't see a raised hand, then there is a way to find it. And when you have your hand raised up, we will know to acknowledge you. Otherwise, type your information in the chat, and then we can acknowledge you at that point. I think that would be the most simple way to go forward. And for those that have done this a few more times than we have, this is our first rodeo with Dr. Abraham. So you might have other suggestions that you will offer us. At this time, we're going to ask Dr. Abraham to unmute himself and to begin to speak.
Thank you so much for that, Pastor Jones, and for all the pastors on the call, and for all the members of your congregations that are listening. This is, a big part. This is an important step so that we can learn, we can engage one another, have a dialogue, answer your questions. And then for all of those that have not been vaccinated, we hope, just like an altar call, you'll go up and get your shot at the end of this. So if you could, I wish you'd come here right now. We're here till midnight vaccinating. My name is Dr. Jerry Abraham, and I am the director of Kedren Vaccines here in South Los Angeles. We now have a location in Watts as well, and we vaccinate somewhere between 2,000 to 3,000 people every day. And now we're expanding our operations as we work to accelerate getting our community vaccinated. Our priority is reaching those that have not always been served, particularly by our institutions. As you know, Kedren is a historically Black institution, started in 1965 during the Watts riots by 22 Black psychiatrists, when during the Watts riots, especially people in mental health crisis, Black people in mental health crisis, had nowhere to turn. And so that's ingrained in our DNA. It's our genetics. We jump up and down, we wave our hands, and we demand, and we say, give us what is ours, and we'll take it. And that's what we did with these vaccines. So our story really begins New Year's, actually Christmas Eve, when I picked up the phone and I said, where are our vaccines? Back then I saw UCLA, Cedars, Dignity Health, Kaiser Permanente, USC, everyone was getting Pfizer, and no one had reached out to us. And I was like, well, my nurses and my patients have COVID. So you'd think that's, obvious. Where would you send the medicine to if people needed it most, right? And so you just see how we weren't even invited to the table when these decisions are made. So we're learning what we have to do to achieve health equity, this race. It's really a race against time. And we have to make sure we bring our folding tables and our folding chairs, and we push aside and we say, make room in the room, because we're here. And that's what we did. And so by New Year's Eve, we had 50 doses go into the arms of our staff here. But we told them right away at the Department of Public Health, our sister organization, our public partner, this beautiful public partnership that we've built, don't give us enough just for me or my staff. If that's the case, don't give it to us at all. We want to make sure that we can help our community. And so we demanded enough vaccines for our Black and brown healthcare workers who had nowhere else to turn and get their vaccines. And that's really how we became known, was the place where no barrier stood in the way between people and their vaccines. We made sure that we reached our frail and elderly. You remember those earliest days when the governor made 65 and older eligible? We were one of those first places that opened up our doors. No appointment, that's okay. No internet, no email, no cell phone, no transportation. Can't talk, can't see, can't walk. I don't have ID. I'm not here in this country legally. I don't have an address because I'm homeless. None of those are reasons not to get vaccinated. Hashtag, this is our shot. This is your shot, and you should take it, and it should be offered to you. And so that's what we wanted to make sure. And that's how we went from 50 the first day to 150 to 300 to now well over 150,000 doses into the arms of Angelinos. And I hope some of them are your congregation members. And I hope that if you haven't been vaccinated, that we are able to have this conversation, this town hall today, this shot of faith, because we all need to protect ourselves. As the pastor said, we got to keep doing our part, which is roll up our sleeves and get your shot when it's offered to you, but you still need to wear your mask, wash your hands, socially distance. This thing ain't over. We're seeing the variants, the mutants, these strains. They are more deadly. They're more infectious. and we need to make sure that we are protected. We deserve to live and survive just as much as other zip codes, just as much as wealthier communities, just as much as people with other skin colors. And that's really the truth. And that's really why this campaign is so important to all of us here in this county, here in your churches, here in this state of California. And we know we've got a long way to go, but this is a good start. So that's really where I want to start. What we do at Kedren is we vaccinate a very high volume of people every day. We do it equitably, fairly, justly. We report that data back accurately and timely back to the various jurisdictions, including the county, the state, and the federal government. And that's our commitment. And because of that, we've gained some notoriety. The governor came and visited us. I testified before the United States Senate on how you equitably distribute this vaccine across America. We've now had the mayor come multiple times. So we're excited to show this work. We're excited that we, this little Kedren that could, this historically Black institution in South Los Angeles, became the Center for Excellence, the exemplary role model of what equity is and can be in this country. And it's not too soon to talk about this because y'all all heard the verdict yesterday. You know where we are as a country. You know how much work we have still to do. So I'm glad we're having this conversation. I think this vaccine's a big part of it. But really importantly, I want to be here to open the floor, put your questions in the chat. Let's answer your questions and let's be ready. And I'm excited about our event with Calvary Baptist coming up. I believe we have that scheduled for May 1st at your church. So we're coming for you and we're bringing our vaccines and we hope to see you there. So with that, I'm going to open up the floor to questions, and Pastor Jones, feel free to moderate. Otherwise, I'm happy to keep talking about all the updates and where we're at. I know Pastor Dr. Sarkis, Mesrobian, he said he had some real questions he wanted us to answer as well. So here I am, and I will be honest and straightforward with you. And that's our goal for the time we have together.
I see a Christian White whose hand is up, or Kynes White. I think that's trying to get it. So go ahead, Christian. Can you unmute yourself? And Sherilyn, you can go ahead and lower the hand.
Okay, I don't know how to do that. Hold on.
Sherilyn, Sherilyn can do that. My sister can do that. Okay, go ahead.
First of all, you're doing amazing things, Dr. Abrams. I'm stunned, really. I can't even find words. I'm working with Irene, your clinic manager. I live in the neighborhood. I live in Ladera Heights, and to get homebound seniors vaccinated. And she has been coming out to one senior at a time. And a question I came across is, there is a woman who she has dementia and she can't find her ID, and that ID question pops up a lot. So what do I tell people who don't have an ID? And the follow-up, and then the next question is, there's a lot of young moms in our neighborhood that are in general anti-vaccine. And I would like to help reaching those young moms. And I want to figure out how to, and that bleeds into Inglewood, but in our neighborhood, where like Baldwin Hills, View Park, all those neighborhoods. Those are my two questions.
Yeah, I'll definitely start by saying we have a long way to go. There's still 3 million people in this county that still need to be vaccinated that are eligible. And it's very important work. As you've seen, millions across this country now have received a vaccine. And I believe it's some 50% now that were eligible have at least received the one dose here in the county, which adds to this herd immunity. And the faster we get to that 70% plus, the quicker we end this pandemic so we can get back to our lives, which include back to work, back to school, back to loving our loved ones, going to church, all those things that we love to do, all those things that we did before COVID. So we have not a moment to lose, not a drop to waste. We can't stop, won't stop until we get there. So thank you for your commitment as well, because a big part of it is just like get out the vote. It's get out the vaccine time. It's time to pick up the phone, just like we canvass the neighborhoods. We have to say, did you get vaccinated? Are you going to get vaccinated? What's the concern? If it's you can't find parking in LA, well, that's not hesitancy. That's let us help you. Maybe we need to get you an Uber or a Lyft. As you mentioned, you have dementia and don't have ID, or you're elderly and homebound. Those are not barriers to getting a vaccine. They definitely should not be. As you know, it's not fair that someone who can't leave their home doesn't get vaccinated. Meanwhile, they may live in a house with plenty of people coming in and out of it, right? So that person needs it just, in fact, maybe more so than all of us did, right? They're very vulnerable. So to your point, as you know, I have said publicly, you may have seen me on Rachel Maddow or Joy Reid or ABC World News Tonight. I have done every news outlet, and the mantra still remains, no barrier stands in your way. And that is my medical license. That is my commitment to the profession and practice of medicine, to help and to heal. And you not having a driver's license or some sort of state issued ID is not a reason to not get vaccinated. We will figure it out. And as you know, we have vaccinated many people without those kinds of requirements. They may not have an ID for a lot of reasons. As you know, where we are in South LA, there are a lot of immigration issues. We have a lot of migrant workers. We have a lot of migrant grandma and grandpas who may not have some sort of proper forms of identification. We look them in the eye. They tell us who they are. We go with faith, we go with God, and we vaccinate. And so that's really the answer here, is that if you're coming, and thank you for reaching out to Miss Irene, by the way. We've been planning out our home visits with our mobile unit, and one of our deputies here, Mario, is actually the one calling and arranging all of those. And it's not easy. As you know, it's much easier to stay in one spot and have thousands of people come to us. It's much harder for us to find who's at home, where we got to go, get to them, register them, vaccinate them, watch them, and go to the next house. So you can only do so much, but it still needs to be done. And in the richest country in the world, in a county as big as ours, with healthy, abled bodies that can help, there's no reason why we couldn't come together and do it. And so that's why we will get to all the people that you're mentioning. But we definitely, for Kedren, I won't say this publicly for the Department of Public Health or the state of California or the US government, I'll say our commitment has been, we will vaccinate people even when they cannot find their ID. And it is hard to do because we've vaccinated a lot of people with housing insecurity, those that live in homelessness encampments. They are Joe or John, Jane Does, right? And that's just the reality. They may not even know their own name. They too still need a vaccine, right? And so we will help them. So we'll meet people where they are. That's a really important part of the Kedren way. We treat people like people as they ought to always have been treated, including Floyd, right? When we think about all these things, that's the basics. Why don't you treat people like people? And the experience matters. And you know that's not how it works in healthcare in America today, but we're trying to bring that humanity back to what we do, including giving this vaccines. To your point about moms, I will say, moms are nervous about, if they're pregnant, babies in their belly, if they're breastfeeding, what's in the breast milk. They're worried about all the vaccines, the vaccine schedule for children. So we understand people's concerns. What we will say is that there are young people who catch it and get very sick. We've seen pregnant women, particularly of color, who have died with COVID, right? So we know that there is a sense of urgency. What we know is COVID kills, and kills at a high rate. We look at the complications, and when we look at the vaccines, what we're seeing with Johnson & Johnson, Moderna, Pfizer, when we look at any sort of adverse complications, far below any complications related to COVID. We are still learning about the vaccines. We're still learning about COVID, but we know COVID does damage to your heart, to your lungs, to your kidneys, to your brain, to your body. So you really have the choice is pretty clear. COVID, those long haulers that are having neuropathy now and dealing with all those issues and shortness of breath for who knows how long, right? So that's where I definitely say I rolled up my sleeve, got my shot. I saw many doctors and nurses get their shot. I saw plenty of Black and brown people come to get Kedren and get their shot. So I hope that these moms you speak of come here, let them ask their questions. We will meet them where they are. We're not going to pressure them. We know our history in this community. We know that the Tuskegee trials were real. We know what happened with Henrietta Lacks cells. We know there's a medicalization of racism, including the undertreatment of pain in the Black community. None of that. That's all real, right? Nobody's making that up, and I ain't going to deny it. But I'm going to tell you, this is not a social experiment. This is a shot of faith. This is a shot at life. And I really recommend that everyone who's eligible, who has no medical contraindications, get this shot. But it is their body, their choice. We are just their GPS, their navigator. We give them all the information. And as a proper, informed health consumer ought to be, you decide what we put in your body. You decide what medication you take. And we hope that you make the right choice. In this case, that you take your vaccine. Christiane, did I answer your question?
Yes. I'll send them to you. And but the people with no ID, do they make an appointment online or should they just show up?
Well, one of the neat things about Kedren is that we're one of the only walk-up sites. Not only can you literally walk up and not need a car, but you can literally walk up without an appointment and get your shot. It's one of the beauties of what we've built here at Kedren. Nothing stands in the way, including that clunky website, My Turn, and all these things that you have to go and do. It's not easy. So show up right now. If people want to show up, we do not have a line right now. We're here till midnight, and we're vaccinating on the weekends too. And we're vaccinating at Calvary Baptist on May 1st. So pick your choice. We will bring all the vaccines, and especially given what's happened with Johnson & Johnson, I am making Moderna and Pfizer available to anyone who wants it.
And I'm trying to get you some funding for your mobile fleet.
I really appreciate that. We need more mobile. We got to meet people where they live, work, worship, and play, where they go to school. So we're coming for you, and we would love help with our mobile clinic. Thank you.
Good. I see Liz Hicks, her hand is up. There was a question about if someone is allergic to shellfish, or I'm trying to get the exact wording they used. Seafood, there it is. If they're allergic to seafood, how does that affect them with getting the vaccine? And then Liz Hicks, you're next. Dr. Abraham?
Yeah, so Pastor Jones, was that coming from Veda? Is that Veda on the line here? Okay, so she typed it in. Very good. Okay. Thank you for your question, Veda. As you know, we are practicing medicine. Unlike COVID testing, this is actually medicine, and we're putting medicine in your body. So very good question. You should know. And so we do ask, and as you've seen when you make an appointment, we're specifically asking about things like, have you had any food or drug allergies? Have you ever had an allergic reaction, anaphylaxis, where your airway is closing up or your lips are swelling, more difficult to breathe? Sometimes people need an epinephrine pen, EpiPen you may have heard of. People take Benadryl or these kind of medicines. So usually what we do with people that have these kinds of allergies, including shellfish, we ask that instead of 15 minutes that you stay and let us observe you for 30 minutes. I will say out of the 150,000 plus that we have vaccinated from Kedren, we have not had to use an EpiPen yet, and we have not sent anyone to the hospital. And then we look at the millions, the tens of millions in this country, actually well over 100 million that have been vaccinated in this country. The numbers are very small in terms of adverse reactions where they had to go to the hospital and or be admitted and or require very critical care. So that's how I would answer that. Hopefully that took care of Veda, your question. Do you have any questions or concerns about that? If not, I know that you wanted to go to Liz Hicks. Was that correct? Correct. Liz, do you want to ask your question?
Hi, doctor. I have two questions. Dr. Abraham, did you not have a program, some channel covered you when you first got started and you had the temporary tents and stuff outside of Kedren? Was that you?
That's me.
Okay. Is there any way that these people here who did not see that, that's why I'm here today. I was so impressed with what you all have done to help them. If they can't fill out their form, we'll fill out their form. If they don't, we'll do that. We'll do that. And you were in temporary, this was outside the Kedren building, you were in temporary things at that time. And so I'm just wondering, is that recorded any place? Because it came on a national station is how I happened to see it.
Yeah, that might be the CBS story. I could put a couple links in the chat box if people want to follow along, but we've had, several stories cover it. As you know, it was not easy. As you know, maybe your doctor doesn't even have vaccines still. You really had to demand this, and it takes a lot of work. It is a very complicated thing, and that's why I'm stressing again, unlike COVID testing, unlike some of the other interventions that we've had to go through during this epidemic, this requires a lot of planning, and you have to be meticulous and careful. You have to watch temperatures, their expiration dates. We need to draw the medicine up carefully in the right needle. We need trained people to put the medicine in your arm. We need to watch you. We need to be ready for complications. So it is not easy. And to your point, Liz, I'm literally sitting outside right now, and it is cold out here. And we have tents everywhere. If you came here right now, you'd be like, oh, am I on the set of MASH? Is this a military field hospital? What is going on? That's what we've built out here. And that's how we have gotten this far. That's how we vaccinate thousands a day. That's how we have so many volunteers who've helped us get here. But yeah, it's taken all of that, and it's not easy, which is why probably a lot of people haven't done what we've done, but we were committed. And, I get sometimes, it's a funny way to put it, but the historically white media has asked me, why did you do what you do? And I usually look at them funny and say, what do you mean? Why did I do you think I had a choice? Like, it was my nurses, my patients, our community, our families, us here. There was not a choice. We all had to play our part to end this epidemic. And that's exactly what we're doing here. And Liz, to your point, I will definitely share some of those stories here in the chat box.
Yeah,
and
so
I hope it moves all of y'all to
if
help.
you can put especially that first one, because I think here they would be so impressed to see what you started from and how it was done. The very first thing that came out, I will never forget that, doctor. I'll never forget it. That's why I'm here. Thank you.
Okay, we're seeing that there's interest in going into the Inland Empire. That's Pomona, Englewood, and Lenox to try to help those in those areas. Do you have a response to that, Dr. Abraham?
Yeah, this is a complicated question. As you know, these mega pods at Dodgers, at the Forum, I mean, that requires you to roll up in a car, wait in your car. You got to have some time to do it. You might have paid time off, or your boss is working with you. You have child care. It's not easy. So clearly to this point, a senior may not make it. A person without a car is not going to make it. Person who's struggling to put food in their belly and a roof over their head is not going to spend their time waiting in line over at the Forum to get a shot. So that's why us moving to meeting people where they are is so important. As you know, we live in a very large county, millions of people. And so it is hard to get to everyone. And that's why we're trying to work closely with the Department of Public Health, with our elected officials. There is a network of all of us that are working together on vaccinating people experiencing homelessness. We're going to the encampments and vaccinating them. And I know that there are people working in different parts. If there are specific issues around Englewood and Lenox, please put them in the box and I will relay that to our colleagues that are working on that initiative. And if you know of someone in particular, I will send my team to them. We don't want anyone to get missed. And so that's definitely why, great question, difficult answer. This is just a glimpse into how broken healthcare in America is. And we just happen, and I'll tell you now, some of the richer folks that came and saw here at Kedren what we do, they were shocked. And I was like, well, that's funny because, we've been dealing with this for years, if not all our lives, where healthcare has never been equal or the outcomes have not been the same. They're just seeing it now because they too are waiting in line here in South LA and seeing all the disparities. So when you look at homeless, medicine, street medicine, the challenge that they're facing right now getting this vaccine are definitely the same challenges before COVID. It is very difficult to find people again, especially if you're giving Moderna and Moderna and Pfizer. You know, we got to come back in 3 weeks or 4 weeks. Some folks are very difficult to find again. Jail populations, very difficult to find in 3 or 4 weeks. They may be in jail for only 7 days, 10 days, right? You get a homebound, frail, elderly person who's kind of off the beaten path. How are you going to get back to them for their second dose? There's all these considerations logistically that make it difficult, in addition to keeping your temperatures maintained, making sure your vaccine hasn't expired. So those are all the reasons why it's been hard, but we are doing our very best to get to them. And just be sure to pass along that information in the chat. You can send as a private message. Otherwise, I'm sure Pastor Virgil Jones actually has my contact, and Kimberly Brown, who's on the line, and we will make it a point to get out and vaccinate everyone who's on this call. If you know someone who needs a vaccine, let us know. Dr. Abraham and Kedren will get to them and get them vaccinated.
I see Tracy Lyons has her hand up.
Yeah, just quickly. I mean, God bless you for what you're doing. I've been kind of following you because you have been in the media. But what can we do to assist? I mean, we know there's folks out there who aren't as savvy with computers, et cetera. What can we in the community do to make your job a little easier?
Yeah, that's a great question. I think now is the time more than ever to reach out to 3 people that have not been vaccinated. Find out, ask them, why haven't you? If it's as simple as overcoming the social determinants of health, if it's as easy as, you know, there are barriers, there are health disparities. I don't have a ride. I don't have internet. I couldn't figure out that clunky website, whatever it is that we can overcome. If it's whether you're black, white, brown, yellow, have real questions about mRNA vaccines, 1-dose vaccine or 2, Moderna, Pfizer, or Johnson & Johnson, then that's what we as healthcare professionals and health educators, it's our job to answer those questions. So identify them and bring them to us, and let us spend time and engage them and meet them where they are and answer their questions. I think that's really important. But I'm really hoping that all of y'all have conversations around your dinner table, you know, in your prayer group, with your churches. You know, are you vaccinated? Don't you want to get back to the things that we used to love to do? Just remember where we were as a people with smallpox, with polio. Think about what we've eradicated. Think about all those. When you think about child and maternal mortality, 100 years ago, we still have a real problem with Black maternal mortality. Black women die at much higher rates giving birth than white people do, right? That's a real disparity that we are overcoming. And there are reasons for it. And they may not get good or high quality prenatal care. We need to overcome those things. But overall, we survive childbirth now than our predecessors did. We are not dying from starvation like our predecessors did. We are not dying from infectious diseases like they used to 100 years ago, right? This COVID-19 is that curveball. Let's hope that once in a lifetime pandemic, and we must overcome it. But know that things like vaccines ended smallpox. And some of y'all may even remember those days, but literally doctors and nurses went around the world on motorcycles vaccinating people. And that's how they ended that pandemic. So, you know, we know that this works. We need people to hear that. We know that you all have a role to play in getting everyone vaccinated. So that's what I would say. I usually say engage, educate, and those eligible vaccinate, and then you become activated. And the best thing you can do once you're activated is talk to 3 people who are not vaccinated and help connect them to a vaccine. And for y'all know Dr. Abraham, y'all know Kedren, y'all bring them here and I'll get them vaccinated.
Good. Okay. All right. So we're looking towards the 1st of May. And what is that environment going to look like?
That's a great question. What I will say is that, you know, phase 1 for us, our Kedren story, chapter 1, picking up the phone, where are vaccines? And that really ends with the media found out about Kedren, and they saw people coming here and standing around the lines for blocks in South LA, people from other neighborhoods, from Beverly Hills, from Malibu, wanting a vaccine. And that became the story, the vaccine chaser, which I discourage demonizing or stigmatizing anyone wanting a shot at a life-saving essential medicine. And this is all of our shot. As you know, the federal government taxpayer dollars paid for this shot. So I don't have anybody, no problem with anybody wanting it. It's just, could you wait your turn was one question. And then two, do you have to come to my neighborhood to get it always? That was another question, of course. So those were some real challenges. But in phase 2, chapter 2 of the book, the world found out about us. And that's when the governor came, the US Senate testimony, the mayor. And so when we get here to phase 3, which is where we announced with the mayor this initiative, live, work, worship, play, that's where we've turned a corner. The eager beavers have come through. Everybody who's waited and camped out, you know, they've been vaccinated. Now it's, look, I got a TV show to watch. I ain't got time for this right now. Or I don't have time for this right now because I'm working 2 to 3 jobs. I need to take care of my kids. I don't have a ride right now. I'm scared because what if I have to go and stand there and wait and it's cold and I ain't got time for all that? Lots of reasons why people are still not getting vaccinated. So that's where we are right now. We are looking at what happened with Johnson & Johnson very closely. We think it's, you know, the way I put it is a very good thing the FDA and the CDC did what they did, which is had the very highest regard for patient safety, for vaccine safety. And they saw 6 individuals, all women between 18 and 44 with low platelet counts, have this complication called cerebral sinus venous thrombus. And they said, let's hold a moment and pause on administering Johnson & Johnson so we understand what's going on. We did not see these complications in the clinical trials because the clinical trials are far fewer than over 7 million people that were administered by this point. So that's why we picked up these 6 cases. But out of an abundance of caution, putting your lives first, patients' lives first, patient safety and vaccine safety first, we are pausing the use of Johnson & Johnson. That's why we are not using it for the events, including the event at Calvary. We are waiting for more information. We are allowing the due process to play out from the FDA and the CDC, and we've got the scientists and the medical experts looking closely, and they're going through every adverse event associated with Johnson & Johnson to make sure it was just those 6 cases, that those were the reasons why. And they're also looking at how best to treat it and make sure physicians know what the right treatment of this particular type of blood clot is. And it is a little different than the way we treat heart attacks and strokes. So that's why that was one other piece, was making sure not only to identify who gets this complication, but also making sure clinicians know how to treat it if it shows up in your emergency room. All indications are that the FDA and the CDC are meeting this Friday. We will get the next update, and the Department of Public Health as of today did give us a heads up that most likely they'll ask us to go ahead and unlock our refrigerators and use it. However, we understand these sensitivities and we don't want to be experimented upon. And that's why here at Kedren, we do offer all 3 vaccines. And I fought for that too, because it's very important that we give people choice and not force anything upon anyone. So that's just one thing that we'll watch closely in the coming days. We do believe that supply is going to outpace demand shortly as Moderna, Pfizer, Johnson & Johnson, they all ramp up production. So again, we're already here where it is getting harder and harder to find arms. Before, it was literally, you know, people wrapped around for blocks. Those days are over. Now we got to go find people. So that's another huge challenge. The FDA, the Pfizer has now applied to the FDA for emergency use authorization of Pfizer to be used in children 12 years and older. So we anticipate that that will be approved shortly. So when that happens, we all need to ramp up and be prepared for middle school and high school students to come through our clinics and get vaccinated. So we're doing that right this moment. We're also working personally here at Kedren with LAUSD to make sure that we make vaccines and testing available in schools. We don't think families should have to go wait in line at Kedren or anywhere else, take a day off to go get your kids tested or vaccinated. We should be able to come to you and help you and not make you miss school or work to do it. So we're looking at those initiatives closely, and we expect that in the next coming week or 2 weeks for that announcement to be made by the FDA. We're also looking very closely at what Moderna and Pfizer are doing with their 3rd shot boosters, whether those will be recommended. You probably heard Pfizer's CEO say that publicly the other day, that most likely that's the direction Pfizer is going. Moderna has been talking about it for some time. Moderna and Pfizer were developed in the summer of 2020 when the variants, particularly the UK variant B.1.1.7, was not around. And now we've got the double variant here in California. We've got several other mutant strains that we want to make sure that we are most protected against. And of course, it's the older patients. It is those with underlying medical conditions that we want to be most concerned about. So they are truly the ones that will definitely need these boosters. We will watch the recommendation. We will be lock and step. We will make sure that we will watch for Dr. Fauci, what the NIH, what the CDC, and what the FDA says, and our California Department of Public Health and our Los Angeles County Department of Public Health. And they all have been lock and step and will follow their recommendations. So when those recommendations are made, we will make those recommendations as well as your healthcare provider here at Kedren. So that's something to watch closely. So as chapter 3 comes to an end this summer around June, and as we go to chapter 4, this uncharted territory, we will monitor those things closely. We don't know where this epidemic is going. As you probably heard in the news today, California is doing really well in terms of its infection rates continue to decline, and we're very proud of that. Some of the lowest in the nation. Part of that probably is from all of our efforts getting vaccinated, all of our efforts playing our part and being socially responsible and accountable to one another. And that's really helped us, and that's going to help us open the state for business June 15th when the governor announced California open for business. But we all have to play our part, and all points indicate that we will have herd immunity by the end of May or June if we keep vaccinating like we're doing currently. Then the next questions will also include things like this fall. Will we be getting flu shots? Will we need an annual COVID vaccine or booster? Those things are up for debate. Unlike the flu virus, the COVID virus doesn't mutate at the same rate the flu virus does. That's why you see an annual flu shot. We may not see that every year, but we're still learning a lot. And we will again watch closely the recommendations. But we in the medical community, the scientific community, will continue to keep everyone accountable to make sure the best recommendations are made and that people's health and lives are priority number one, and that the recommendations that are the safest and best for us. And you better believe I would never offer a vaccine if I didn't believe it was in our best interest. And that's just the truth. And that's why you go to a trusted healthcare provider. And that's why we're glad to be here at Kedren, because you can trust us. We are in your community. We are your community. We are your family. And so that's why I keep listening, and I'll keep doing my part, which is making sure that I follow the science and see what the experts are saying and make sure that I practice the best in sound medicine. So hopefully that answers some of the what's coming down the pike in the next several months.
Gotcha. Okay, so all age groups at this point, there are no age restrictions except for, I guess, those that are still in elementary school, I would guess, or in, the lower grades. So what would be the are there any age stipulations at this point is really the question I'm trying to ask.
Yes, for Pfizer, it is emergency use authorized for 16 and older. Moderna is authorized for over 18. Johnson & Johnson is authorized for over 18. Pfizer has applied to vaccinate children 12 and older, and all points indicate that the FDA will approve their application shortly. And then to your point, children still are spreaders of COVID-19, which is why LAUSD, the teachers unions are still keen on making sure children are tested. Our pushback, our concern is, that's a lot of burden placed on parents and their children to have to go get testing. So if testing is a requirement, how do we make testing more readily available and or accessible in the schools themselves? So we'll keep continuing to play our part. So today we actually have been in dialogue with LAUSD to be able to provide more of those services in our schools. I know many clinics and many healthcare professionals are trying to do that because we got to get back to school and our kids have to learn. And we think they did lose a lot this past year. Some of them didn't really have the best educational experience, and also just learning social skills and all those things that we do, even from going to church. As you go to church and you learn how to grow up and how to interact with people and right from wrong. Those things are some missed opportunities that we got to get back to. We talk about this Sunday is the Oscars, right? People want to go back to the movies. People want to get back to playing sports. People want to get back to church on a Sunday morning. So we kind of got to do all these things to get back all those missed memories that we have lost in this last year. But yeah, we're watching very closely the recommendations for our school age children so that the schools can fully open properly and safely and not put teachers or their families at risk. Because as you know, the kids are infectious and they come home, and then unfortunately, if they give it to grandma, grandma can get very sick. So we're going to be very mindful of asymptomatic super spreaders that we saw. And that's the same thing with church. We're going to continue to watch the science. Will we be able to sing? Will we have choirs? Can we go inside or not? How much spacing will there be? How much of our activities can we take outdoors or into our parking lots? Those are all things that every one of our churches should be looking towards. And I will continue to watch the science, and we'll continue to report back to A Shot of Faith town halls on the best practices for our houses of worship.
Gotcha. Okay, so do we know which vaccine we are potentially going to have on the 1st of May?
My understanding is that we were approved or allocated for Pfizer for the event at Calvary Baptist. However, I will offer both because I know some people have some different considerations and or they may be coming for their second dose. So we definitely want to be able to help people get their second dose. And we will have that allocation of Pfizer from the state, but I will be sure to have some inventory of Moderna along. By that point, if Johnson & Johnson is available, I will bring it along because I still get people showing up wanting it and very upset and frustrated that it's locked up in our fridge. Some people want one and done. Some people like that adenovirus vector technology that they're familiar with. That's the same technology that we use in the flu shot. So some people feel like it's a technology that they are, it's been around longer. So there's some different preferences. We understand that, and we do our very best to accommodate people and to meet them where
Who's
they're
in
at.
charge?
Okay,
Pastor Miss Roby, and I think you're unmuted.
Am I?
yeah, you're
No,
unmuted, sir.
I'm fine.
You're unmuted.
All right, Dr. Abraham, truly, it's a treasure of information that you're conveying to us. The concern that we have is our congregation. Can you hear me?
Yes.
Yeah, our congregation was very excited about Johnson & Johnson, given that it's only a single jab. And they were very disappointed all of a sudden when the CDC intervened and when they realized that the manufacturer absolutely missed a couple of ingredients even into the vials. How do you address these concerns?
Yeah, no, as you know, vaccine safety is a critical issue. I actually have some folks around here from public health who actually I'm looking to will right now. Anything on the product safety that we saw with the Johnson & Johnson, well, it was actually AstraZeneca plant that was put offline and put into the supervision and oversight of Johnson & Johnson in Baltimore. So actually that is a interesting subject because as you know, there are vaccines that are not FDA approved for use in the United States, including AstraZeneca, because they did not meet certain requirements. And that was the facility that had the quality control issues in Maryland that the federal government asked Johnson & Johnson to step in and supervise that particular facility. I will tell you, it was a very rigorous process to achieve FDA approval and achieve emergency use authorization, even though accelerated processes. Plus, there were independent review boards, including our National Medical Association, the Historically Black Medical Society here in America. We're watching closely given the history. So as far as the three that achieved approval, Pfizer, Moderna, and Johnson & Johnson, they all met all of the requirements to be used for vaccines in America for COVID-19. Yes. That was its use. That is the emergency use. Now, as far as what happened with Johnson & Johnson, again, that is a difficult thing to communicate about. 6 women with serious complications with these clots. Again, women 18 to 44 with low platelet counts already. And then they were the ones. And so out of an abundance of caution, making sure that we look through all complications to see if any of them were related to this. And we will await an update on Friday, including possibly next week, them telling us to use it. But you're right, it makes it very hard because I had many patients, including those that experience homelessness, who really still prefer it. There are plenty of people, to your point. I have neighbors, my own neighbors, who really want Johnson & Johnson or got Johnson & Johnson because it was just that one shot.
That's right.
It's a difficult question to answer because these vaccines really work. You know, everybody, literally everybody is different. And that is the truth. So while we might say 94 or 95% efficacious, Moderna, Pfizer, 70 something percent, Johnson & Johnson, the truth is, depending your age, depending on your underlying medical conditions, if you have cancer, if you have some certain chronic conditions, you may not achieve those high numbers of efficacy, yet you're still gaining the protection. What we know is all three vaccines are highly efficacious. In fact, 100% efficacious at preventing death due to COVID. They reduce the risk greatly of being admitted into an ICU and put on a ventilator. They reduce your risk of hospitalization or serious illness. So even though we've seen a few cases of people who still got COVID after getting vaccinated, they did not need to be in the hospital and they recovered much faster. And that happens all the time with the flu. I'd much rather get the flu shot and get the sniffles than not get the flu shot, get pneumonia, go to the ICU and die. So that's kind of why, and that's kind of the math, that's kind of the logic that we have to use. Again, if it's not safe, we're not going to use it, period. And that's what we do all the time in this country, as you see, whether it's recalls or whether it is suspensions. And in this case, this pause, that goes to show you the rigor, the prioritization of your health, your safety. Otherwise, they could have just said, go on with it. No, instead they said, hold on a minute. Let's make sure out of an abundance of caution that we're doing the right thing, offering Johnson & Johnson. But you bring up very good points. We in the medical community are always holding pharma accountable. As you know, we are very concerned always about putting profits over people. That is a real concern that we see every day in medicine, right? So those are much bigger conversations, that these are people's lives and it is not about some bottom line or shareholders. And so we're watching those situations as AstraZeneca, as the World Health Organization, global vaccine initiatives go forward. There are vaccines developed in Russia, in China, in India, in Brazil that are being used. So we know we got to bring essential medicines around the world, including here in the US, and they need to be cost effective and they can't break our own pocketbooks or our country's pocketbooks. And they should not penalize poorer countries either. Just because you live in a poorer country doesn't mean you shouldn't get a vaccine. So we're all watching and monitoring and doing everything we can to advocate for those reasons. But of course, absolutely, whether it's any medicine, not just these vaccines, we want to make sure we monitor and they uphold the highest safety standards. And that a life is a life, as we talked about yesterday, as we all talked about yesterday in the media. You know, that is a human being. George was a human being and needs to be treated as a human being. And that is not what happened to him when that situation happened there in Minnesota. So likewise, you know, when I think about even 6 people, those are 6 human beings. So let's, out of an abundance of caution, be careful and safe and do the right thing. And we're being told that the right thing probably is going to be, they're going to say, go ahead and continue to use it. They may put certain cautions, or they may say certain individuals should not receive that vaccine. But we do that all the time, even with Pfizer, Moderna. We do not use Pfizer, Moderna in people that have received monoclonal antibodies for the treatment of COVID-19. That's Regeneron. Those are those medicines that you saw on the news when you heard people go to the hospital, including, I think, President Trump, when he was there, got this Regeneron monoclonal antibody. So there are contraindications to all of them. And we'll watch those closely and make sure that we only offer these medicines to those who are medically eligible and have no contraindications. I hope that answers your question. I know it's long-winded, but it's a very important topic.
I really appreciate that. Also, given the Moderna and the approach with the mRNA, which is unprecedented between Pfizer and Moderna, we being a small congregation, 2 members of the congregation who received the second shot of Moderna, they developed inflammation of the heart and they developed the arrhythmia and the tachycardia. Luckily, they will manage adequately at the ER. But the heart rate on one case went like almost to 200. The other one was about 150. Have you seen this inflammatory adverse responses to the second shot of Moderna? It happened to 2 people of our congregation.
Yeah, I am not familiar with that particular side effect here. So not here at Kedren, but I have heard about tachycardia after a second dose.
That's it, yes.
And the issue here is teasing out, based off of the sheer numbers of people that we're vaccinating, are these related to underlying conditions, or are some people at higher risk? Definitely would need more specific details. It is unfortunate to hear that 2 members from your congregation experienced this, but we need to understand more context. The younger folks, those that may not have as many underlying medical conditions, they may have a stronger response to the vaccine, sometimes specifically that second dose, and their body's doing exactly what it ought to. It is ramping up and recruiting all of your troops, calling in the cavalry so that you have all those antibodies when it's time to fight off that COVID-19. So, when people that are younger feel under the weather a couple days or the next day after, that's really what's happening. That's why I always tell everyone, whether you come to Kedren or not, feel free to take Tylenol or ibuprofen. You can alternate them as needed. There's no reason to suffer through it. But people definitely leave here with muscle soreness sometimes at the site of injection. Some people have felt under the weather, and that is your body mounting response. In fact, in many ways, it's exactly what we anticipate and expect. It's a good thing, in fact, that your body's working so well that it's mounting that response. Unfortunately, it doesn't always make sense. You just gave me a vaccine. Why do I feel sick? And that happens sometimes with other vaccines as well.
Thank you.
All right. So on May 1st, we will start around 9 a.m. or so. What's the setup time so that we would know how early we need to have someone here to kind of get things ready for you?
Sure. Reverend Donisha Beaver, who helps us with our A Shot of Faith initiative and all of our worship and houses of worship work, she'll be in touch. I believe you had a point person that she's communicating with. We usually get to the site by about before 8 o'clock, and we usually try to vaccinate between 9 to 4. And then we try to wrap up and be out of there by 5. And our goal is to vaccinate 1,000 people. So I know that it's going to be, contingent. What's the word? All of us are going to have to do our part. And we're going to have to bring 2 or 3 or 4 or a busload of people along with us to get to that goal, because that's what we're planning to do at Calvary Baptist on May 1st. Be ready, roll up your sleeves, 9 to 4. Let's get vaccinated.
Okay, and if someone has diabetes, no issues there, you think?
Absolutely. So this medicine is actually really important for those that are maybe have underlying medical conditions or older, more vulnerable, those on the front lines that are exposed to the public regularly. So absolutely, this is the medicine that you need if you have kidney disease, diabetes, heart disease, all of those things. Those are actually priority groups. And that's why we've, made sure they actually got the first shot at this vaccine early on. So please do, by all means, bring all of your friends and family, especially those that have underlying medical conditions, on Saturday, May 1st to Calvary Baptist.
Wonderful.
Okay, so you're going to have, I see a hand, Tracy Lyons.
Just real quick, are you going to have advanced signups, or is it simply first come, first serve?
Usually we usually coordinate with someone at the church just to kind of gauge where we are with the numbers. We usually do walk up for sure. It's getting harder and harder to get arms, so I'm less worried that we're going to go over 1,000. What I'm more worried about is us getting to the 1,000. So that's kind of where we're at. But in general, we try not to create any clunky pre-appointment or requiring appointment to come to these events. However, sometimes we say, just let the church know so that we're kind of keeping track, or whoever our point person is, just so we have an idea how many to expect, because we wouldn't want to bring and waste any doses either. So if we know that we're far less than 1,000, then we might change or alter some of our planning. But of course, we're prepared to vaccinate 1,000 people on May 1st at Calvary Baptist.
Okay. All right. And so the paperwork that would be filled out on the spot, about how much time does that generally take to complete?
Great question. Matter of minutes. We have a team of people that will help fill out forms, and we get you through the registration process, give you your vaccine card, vaccinate you, watch you for 15 minutes, and you go on your way and get on with your life. So hopefully the whole thing, all together combined, it doesn't take very long. It takes less than 30 seconds to vaccinate someone. It's all the paperwork and reporting and data that can make it longer sometimes. With our paper form, we get you through real fast.
And then the second dose, that would be either 3 or 4 weeks from May 1st?
That's correct. We will continue to work with your church to schedule that properly. We are anticipating using Pfizer, which would be 3 weeks after. However, if we're using a mix of Moderna and Pfizer, we may come back in 4 weeks instead. So that way everybody is eligible regardless of whether you got Pfizer or Moderna. And then we would just make sure we get everyone their second dose. Anyone who can't make that second dose, of course, just come to Kedren and you'll get your second dose.
All right. And then for those, how many persons are going to need parking? Because our thinking is that we would park all of the cars, I would guess, at St. James Apostolic.
Sure.
That way, we've got all the space we need for the people to maneuver, and you'll probably still have some people driving up and parking on Calvary's lot that's coming specifically to get the vaccine. So about how many persons do you think are going to need parking spaces that are going to be working specifically on the vaccination?
That's a
effort?
good question. It can be a tough question. We definitely can shuttle people back and forth from Kedren if we need to. We tend to have about 8 to 12 volunteers from Kedren, and then we usually have whoever is coming from the church or from the organization itself as well. So in our past events, for example, at First AME, we had probably altogether about 40 volunteers, but not all of them brought their own cars. And then with street parking across the street, we were able to accommodate everyone. And when we come from Kedren, we try to definitely bring people in groups, so we're not all coming in one, each person in their own vehicle. But we do hope that some members of your congregations will be there on hand to volunteer and to help. Clearly, there's line control. Some people can definitely help volunteer to register. We need people to just help and watch and, help encourage and nudge people to get on their way. Mm-hmm.
Good.
And Pastor
So
Jones,
yes.
the parking lot at Knox will be available as well. And we'll be happy to recruit volunteers and to support the event wholeheartedly.
All right. That's Pastor Ragland. He was able to get free.
Sure.
Wonderful. And I will say we do have, we've partnered with a couple community organizations to offer Lyft rides. So we can put that information here in the chat box, but it's www.vaccinerides.com. And if you have any issues with that, we actually have a partnership here with a couple of organizations that are helping make sure that transportation is not a barrier.
Now, I understand we're going to get a flyer within the next couple of days that will kind of be used as our point of sale. So we will get those emailed to the respective pastors, and then those church members would then disseminate email, text, and pass out these flyers throughout our community. Does that sound accurate?
Correct. We'll work with Reverend Donisha Beaver, Miss Kimberly Brown from LeGrant Communications. I believe there are people here from LA Focus and Lisa Collins' team. So we'll make sure that messaging, outreach, in terms of developing a flyer, all those things that we've now done for several church events, we'll be sure to provide for your houses of worship and get the word out. So I'll definitely rope in Reverend Donisha, who's going to work through some of the more details. However, I don't know if Kimberly, do you have anything you want to add on the communications front or flyers?
Well, as you said, Donisha will handle the coordination, but I can say for the flyer, that's part of what I am handling. And yes, you will have a flyer for you to be able to distribute to your church members, to your community, and whoever else you want to share it with.
Perfect.
Thank you so much, Kimberly.
All right. All right, well, are there any other questions? Because we've been at it about an hour now. You know that we've handled a lot of data here. Does everyone feel that their questions were answered even before you asked them? And if not, then this would be the appropriate time to press in on that subject.
Okay, and I'll put a couple links there if you really, I know to y'all's point, following some of the stories about what we do here at Kedren. So feel free to watch that in your leisure. It's been a fun journey and we'll keep doing it. And I'm sure this is just the beginning of our partnership with Kedren. As I say, this is the gateway drug. This is the gateway drug to connecting people to primary care, mental health, preventive services, and community building. So I'm glad that we're all in this together.
All right, so can we get everyone to give him a rousing applause? You can type it in, or you can just do the old-fashioned way.
Thank you.
Thank you.
Thank you so much.
Gene,
Appreciate it.
we thank you so much for everything that you're doing for our community, and we're looking forward to May 1st and the subsequent day after that, that we will have the 2 vaccines presented, and then we will coordinate the dissemination of the flyer once we receive it, and we will send it out to as many people as we are able to as soon as we get it. All right?
Thank you.
If anyone wants to just go directly to Kedren to make an appointment, you again can just walk up. You just drive your car over there, park, get out, and go in and say, "Here's my arm, doc."
We're here till midnight. I say, come on down today. Why delay? Don't hesitate, vaccinate. Let's do it.
All right.
All right.
Okay, so we're recording this. It'll be on YouTube later today. So if you've got parishioners or people that were not able to be on this call, you can certainly forward them to the YouTube link, and you'll be able to find it. Just look for Calvary Baptist Church, and I'm sure it will be identified as a vaccine link or something like that. That would be obvious. And then all the data that we have here will be on there. And then, of course, you can go to kedren.org and get your data from there as well. Okay?
That's good. All right.
Pastor Ragland, could you pray us out, sir?
Absolutely. And before I pray, let me just thank everyone for attending, and certainly Jerry for that wonderful information, and really appreciate Kedren and all of the affiliated agencies and organizations working together to not only get the word out, but to help clarify the mystery and the quandary in which we find ourselves. And so information helps to not only take care of myths, but also it helps to clarify a path forward to get out of this situation, both individually and for our respective families. So thank you again. Having said that, we do want to enlist everyone that's on the call tonight to be a participant in promoting the May 1st event. And we really do want to try and hit that 1,000 number and get as close to it as possible, because we know that there's a great need within our respective community. So again, thank you very much. Let's pray. We are grateful and thankful, Lord, for the opportunity we've had to share and to engage in open and transparent dialogue and conversation about this pandemic, this virus. We are grateful for the many remedies and vaccines that have been produced to help rid the world of this infection. We ask for your continued intervention. We ask for the goodwill of all human beings to be brought to bear as we all seek to work together and find new paths forward out of this situation. What a blessing it is, oh Lord, to have volunteers and supporters and individuals seeking to address communities where information often is lacking and where resources sometimes are lacking. So we are grateful for this unified effort to bring as many resources together as possible to meet this need. Lord, we're grateful. In the name of Christ, we pray. Amen.
Amen.
Amen. All right. God bless each and every one of you, and we see you at the next go around on May 1st.
All righty.
Good night.
Thank you all very much.
Thank you. Bye-bye.
1 second.
Attorney General.